Hi, my name is Gregory and I work for the Advancing Quality Alliance, better known as Aqua, as a Programme Facilitator. And today I'm going to be talking to you about what we know about whole system flow and how we're going to utilise that learning within our FISP programme. So what exactly does FISP stand for? Well, it stands for Flow - Improving System Pathways. And now this is the interesting bit, so I'm going to try and deliver this to you today using a Japanese style presentation format called Pecha Kucha. So this is a format that gives me 20 slides, and I've got 20 seconds per slide, and they automatically rotate in the background without me having to click or anything. So the pressure's on me to give you as much information I possibly can within that 20 seconds, but I'll let you be the judge whether it works or not. So, what exactly have we been up to?
Well, over the last 18 months, Aqua have been trawling through all of the existing research, evidence, data, case studies available on whole system flow from across the world to pull all that information together and formulate a really good offer for our members, as I mentioned before. We've actually summarised that information within a really useful 80-page document. The link should be on my right-hand side now, fingers crossed, that we were co-commissioned to do with the Health Foundation. It's called The Challenge and Potential of Whole System Flow, and it's a really good piece of work, definitely worth checking out. So, what exactly is flow? Well, flow is the combination of resources that come together across a system to formulate the pathway of least resistance, and it can apply in many forms. So it can be within healthcare, within the aviation industry, or even on election night between Sunderland and Newcastle, as is the example I've chosen to show here. But what does flow actually mean to us? Well, if I was to ask everyone to draw or to map the system that they work in currently, I'm sure you do a fantastic job of making it look really simple and a really complex system look really easy to interpret and easy to sort of understand. However, we need to understand that from a patient's perspective, it can look very different, as this shows. So this was actually an elective patient who drew their journey, and it kind of really hits home when you sort of compare what we might sort of write down to what a patient might write down. This has formed a really key part of our learning, and it's helped us focus the 4 arrows. So there's 4 really key pieces of learning that we've come across, and the first of which is people. So it's understanding that patient journey. We really need to focus on understanding exactly how people see the healthcare system that they're moving through and what they want from that system, because if we don't, ultimately we're going to design services that don't quite match their needs. Secondly, we've got information. So this isn't just about one computer talking to another computer 10 miles away and sharing information. This is about the way that staff communicate with each other, how staff communicate with each other across different systems, across different organisations, but also how we communicate with our patients and how we communicate the service and the system that they're within to them. Thirdly, we've got total workforce. In the same way that we need to understand the patient's perspective, we also really need to understand how the total workforce and staff on the front line view the system that they're working within. Because ultimately, they'll have a completely different viewpoint to a lot of other people, and they'll see different ways of working, they'll see the little sticky points within that system, and tapping into that is crucial. And finally, finance and resources, the elephant in the room. We need to accurately and to efficiently map and improve flow. We need to understand what we're working within, whether that be budget constraints, performance constraints. Can we alter the way that we report our KPIs to create a more creative way of doing things? They need to be in the room. If they're not in the room, or if any of those 4 arrows aren't present during the design or redesign of a system flow, ultimately they'll be the one that get the blame. We also came across a really useful tool called the double diamond. So a lot of people are guilty of this, myself included. We often jump to solutions. We don't spend enough time focusing on exactly what the problem is, which is what Aqua have been trying to do over the last 18 months. Because if we don't spend a lot of time focusing on the problem, we often develop the solutions that don't quite fit. And if they don't quite fit, then it's a waste of time and a waste of our efforts and our skills, really. So that was sort of summarising our key learning from flow. There's also, we came across a really useful article in the BMJ, which is 6 ways not to improve flow, and it's stuff that we're all really guilty of, again, myself included. So the first one is that we often focus our energy and our attention on the wrong part of the system. We've not utilised the double diamond that I've just spoken about in the right way. We've not fully understood the problems facing us, and therefore we've sort of dived in head first. We've solved an issue that we have, but it's not necessarily the one that we needed to solve. So a patient might be ready for discharge a day early, but they've nowhere to go at discharge. Secondly, we often add another form to an already complex system. How many times do we approach a staff member with what we think is a great idea and ask them to do one extra bit, one extra part of the process, and they meet us with a blank look because they don't actually want to add things into the system, they want things taken out and streamlining. Thirdly, we often create car parks. So we might think that we're achieving our targets and it's great we've achieved flow because patients are moving out of our system. But if they're just moving on to an area where they're going to wait and they're still in the system, so ultimately we've not solved flow for that particular patient, they're still part of our system. We do such great work in solving bottlenecks on a daily basis, but often we don't follow that bottleneck along, so we don't search for any knock-on effects of that. When we solve one, often there's things later down the line or further along in the system that also need solving as a result, but we don't do that. So to accurately solve flow, we have to make sure we follow the bottlenecks along the system. How many times have we at Christmas been given a present that we think, oh, if only they'd just asked me what it was I wanted? The same applies in healthcare. We need to make sure we understand what it is our staff and our patients need to be able to design services that fully wrap around what they want. And finally, we need to make sure we work as a system, not in silos, to make sure that any extra capacity we can generate is spread across the system in the right way where it's needed most, rather than holding on to it and being very individualistic in the services that we run. We need to make sure we operate as a system and use the capacity wisely. And the final slide that I'm going to talk through demonstrates the healthcare system and social care system. So we've got the green is primary care and all out of hospital services, and the blue is acute. Now often we focus on the small blue section here, but to accurately solve whole system flow, we need to make sure we focus on both the green and the blue evenly to solve any issues that we do have. So that concludes your whistle-stop tour of what we know about whole system flow by Pecha Kucha. So as I mentioned within the presentation, we're currently working with 3 systems across the Northwest to test what we've learned over the last 18 months. And those systems are Bolton, who are trying to improve flow across their intermediate tier of services, Liverpool, who are trying to improve pathways for their complex group of individuals, and Wigan, who are trying to improve their respiratory pathways. So it's important to stress that whilst we're working with each of those 3 sites, we don't have the answers currently, we're just testing what we think we know. And we're going to try and keep you updated with our learning as much as we can over the course of the programme. If you have any more questions or if you want to get in contact, please either contact myself or Wendy Lewis, and we'll be happy to go through the programme in a bit more detail with you. Thank you.